I mean, I'm never going to leave you. I'm never going to go to another physical therapy office. I'm not going to, opt for some other treatment or care or whatever. And if I did get, some consult for some other surgery or injury or whatever, I'm probably going to come back to you and ask like, hey, what do you think? Whatever. My point of this is this I think could help any practice in the in-person plan of care buy-in, the whole therapeutic alliance. I mean, that.
So last time, Tuesday, I said something about the salaries and stuff. I found a new YouTube channel that talks and explains, like in normal language, how these guys are getting $700+ million contracts. It talks about how the MLB like breaks up what they pay, what they earn. I just can't fathom this kind of money. But some of the interesting stuff was how Ohtani has he's getting $2 million a year now, but he's going to have a huge payout down the road. There's penalties. I would love to discuss how these penalties for exceeding certain salaries, how this would come into physical therapy. Because what if?
I don't think we have that. I don't think we have that problem.
We could though. Seriously. What if I wanted to attract a celebrity PT? We've talked about that in previous episodes. And I'm like, look, I will pay you $100,000 base salary, but I'll give you a $300,000, not a $12,000, a $300,000 bonus if you achieve these certain metrics.
Yes.
And for me, the metrics would be, growing the media, growing the brand. The same thing, if Nike can pay Caitlin Clark millions of dollars, and I haven't even seen a Caitlin Clark shoe come out. I haven't seen a Caitlin Clark anything happen. We could probably do something like this. We just have to find the value on the other end. So, Dave, you know more than me probably. What's the deal with 2026? Is MLB going on strike again? And how can there possibly be a union that says, you know what, $700 million just isn't enough. We can't survive. I want more.
Well, I'm prepared for this topic because I have not researched too much on the 2026 MLB situation. I don't understand. Yes, with Ohtani and then Bryce Harper before that. So then Ohtani and then Juan Soto.
Yeah.
I agree, but that's just the going market. I don't understand. I thought you were a free market guy, Tony. I thought you'd be okay with this. I thought, if there's a buyer out there, if there's, someone who's willing to spend, why not have at it? And that's just the going market. If you wanted to land Shohei Ohtani or if you wanted to land Soto, you had to pay up. And there's only, 2, 3, 4, 5, whatever teams that would do so. But I think, first of all, kudos to these agents. These agents are probably making, 5 or 10% of this, life-changing money, but they've already, these agents are already successful, like Scott Boras and all them. So I don't know too much about the MLB situation. I don't know at this point, I think you're beyond an MLB salary cap. And I don't know if it would even make sense at this point or next year to try to knock that down. If there's owners crazy Steve Cohen who owns the Mets and he just will spend unlimited money and, basically with future projections of this will result in X amount of wins, X amount of, home runs and wins and potential playoffs. And then that results in extra amount of playoff ticket revenue and, the revenue from parking and other brand deals or what, just everything. I think we should talk more. I think the audience would, be interested more about the physical therapy side of things. If we wanted to land, $100,000, $150,000, $200,000 physical therapist, how could we maybe make sense of that or try to?
Well, I see the crossover with what Tony is saying. So first off, it's a brilliant move on the part of owners or insurance companies. There's the parallel, right? To say, can't believe you want more. You're making $700 million. Must be coming from somewhere. So notice we don't talk about what the owners are making or what the insurance companies are making, right? We just say you want more? How am I supposed to give you more? We are in an attention economy. Baseball's made up, right? It's a bunch of teams who play for a thing that's invented. I was at a game last night until 2:00 in the morning. I didn't get home because there was a rain delay, but there were people there There were people at home watching TV. There were people, as Dave just mentioned, parking and buying T-shirts and buying food. There's Shake Shack. I mean, there used to be like, Sabret or Nathan's Hot Dogs. And now you've got premium brands saying, we want to be in front of this audience. So I think unless you start thinking like that, no, there's no chance of you getting a large deal as a great physical therapist. If you're going to say it's in charge of the owners are the ones deciding to pay me and how much my time is worth, and I will forever make $60 a visit, $60 every 42 minutes.
The only pushback on that is that the owners are exceeding like just money is no object. And then the insurance companies paying providers is obviously like the opposite direction. But I see what you mean in terms of the forces in the dynamic.
There's money there. That's why the players are smart enough, right? And in this conversation, and I just looked it up. It says a lockout is more likely than a strike. That's where a lockout is where the owners prevent the players from playing after their collective bargaining agreement ends. The thing we have going here, the collective bargaining agreement, it's not with all of us. It's with individuals, right? So we don't have a union. There is no, and I know people have talked about it for a long time. We should unionize. I don't know anything about starting a union, but it just seems we're not all playing in the same league. We're not all playing in the same game. We're very, very separate. So I try to do as much of a parallel as possible.
Now, so real quick, going back to what Tony was saying about how could you license or partner with physical therapists that are like popular on social media or whatever. I want to hear Tony's thoughts more on that, because I know that Barstool, I've heard Dave Portnoy say on one of the recent podcasts, I think it was maybe with the Shannon Sharp interview or something, he was talking about when they find talent that no one knows about, they sign something like a 3-year or a 6-year deal. And like, then they put this talent in front of their audience. And then after the 3 or 6 years, like Pat McAfee was with Barstool. Now he left and he's got the Pat McAfee show on ESPN, and he was able to just walk away. But Barstool was able to capture, X amount of value and attention and all that, growing these talent from like local or, regional to national or global. So I would love to hear more what Tony thinks about this.
So this all ties into physical therapy, and you're right. Like, we're not going to talk about baseball, but what are the lessons we can learn if we look at, and I researched a little bit of it. It's not just, okay, I can sell tickets to a game. 40,000 people go to watch the Reds beat the Phillies last night. That's fine, a couple $1 million, but you've got the merch, you've got the licensing, you've got the TV deals, you've got all of this other stuff behind it. It's just like the physical therapist here. So I shared a post recently about product endorsements, product placements. I'm like, if Coca-Cola is going to pay $1 million point something to have one of the characters of Stranger Things drinking a Coke on camera, like, I'm out there in the gym, I'm using branded walkers, branded canes, branded dumbbells and machines. Why am I not monetizing that attention? And so we could take this in so many different ways, and we can say there's so much value being generated here. Their brands are willing to pay for, and that's really where all this money is coming from. So how do I make a $350 or $1,000 offer to a great PT? I make sure that I monetize everything around that PT.
Yeah.
Brand deals, merch, equipment. We get into equity deals with product companies, all of that kind of stuff. The other part of it is right now, there's apparently 2 professional organizations representing physical therapists as a profession. Both of these organizations are fighting for the right for a therapist, a PT, to opt out of Medicare. Physicians can do it. I think dietitians can do it. There's a small list of providers who can do it.
What? NPs.
Yeah. Nurse practitioners, PAs. So right now, both organizations are trying to achieve the same goal. I think it'd be funny to see if it happens, who claims the victory. That'll be an interesting episode. But anyway, so Jimmy was saying, before the show, he didn't know enough about what does it mean? What does it do? Right now, there's some comments floating around saying, well, this is only going to benefit cash-based PT. It's not going to benefit the majority of Medicare beneficiaries who, quote, would never pay cash. One therapist said he's been a therapist 21 years. He's never seen or heard of a Medicare beneficiary willing to pay cash. I've got people coming into my clinic that say, I don't want you to bill Medicare, just charge me. Like, it is absolutely doable. So, Jimmy, what this means is I, as a physical therapist, if I wanted to get rewarded for working harder, be able to sell better outcomes, not get paid the minimum wage no matter how hard I work or how little I work, I would be able to opt out of Medicare. It's a contract I signed with Medicare that says I am an opt-out provider. That then gives me the right to talk to a Medicare beneficiary, say, I see the problem. I have the solution. This is what it's going to cost. Do you agree? We enter into a private contract, and then the Medicare beneficiary could pay me cash. One of the big things that happens is if you do elect to be an opt-out provider, you cannot be a participating provider for 2 years. So it does limit your ability to accept Medicare reimbursement. But that's like me saying, I want to be a professional. I'm not going to be able to accept minimum wage for the next 2 years. Like, I think I'd be okay with that.
Right.
You know, and so this gives the patient, the Medicare beneficiary, freedom to choose. Do I want to pay for this, or do I want to go across the street and have it paid for by Medicare? It gives the clinician the right to choose. Do I want to accept what Medicare is paying, or do I want the option to do more and charge more for it? I think it's a great deal. Like, it's one of the few things that I could actually say, yeah, I would support something like that.
Why was it put in place? Was it consumer protection? What was it?
I have to think, and this is speculation, it goes back to big government protecting the vulnerable patient from the greedy, hungry, take advantage of you, physical therapists. But it's not just us. It's all healthcare providers. I think it's got to be patient protection. All right.
Does it go through?
What's that?
Do we think this goes through? I mean, I had ChatGPT analyze the current situations. You know, one is an advocacy route. The other is a legal. They're actually suing the Health and Human Services Director. They're suing RFK. And ChatGPT didn't give it a high likelihood for success, but that's how these things are started, right? You've got to make the move, and you've got to sit down at the table and make a move to make anything change, right? I mean,
yeah, I think you burn political capital for very little reward. I think most PTs who want to sell cash-based services to Medicare beneficiaries, the only stipulation is you can't provide medically necessary Medicare covered services to a Medicare beneficiary and charge cash. Well, I can guarantee the vast majority of cash PTs out there today, they're not delivering what would be a covered service anyway. They're delivering above and beyond what would be the Medicare criteria for covered. So it doesn't matter. It's not even like you're saying it applies to only cash PTs. It applies to maybe a tiny fraction of cash PTs, which is like infinitely small. We're probably talking 30 individuals in the country. It is a ridiculously small number.
Understood.
Yeah, I don't know what the upside is. I don't know what's the benefit. I mean, we've talked about it before, or at least I mentioned it because I'll take ownership of it, that there's so many practices across the country that are billing Medicare for outpatient Part B Medicare physical therapy services when the individual is able to basically jog to the physical therapy office jokingly, meaning like they don't have any issues with their ADLs. They don't have any issues with toileting, dressing, bathing, cooking, cleaning, personal hygiene, anything like that. And they want to be able to, run in or walk an extra 5 blocks or whatever, but they can already walk 5 or 10 blocks. I mean, that's one of the biggest reasons why I think that a lot of this healthcare payment is plateaued or decreased because of all the abuse historically, all the fraud and the abuse. And so it's like these folks are not really qualified. Many of the Medicare beneficiaries are able to walk and do stairs and do many, many things more than what would be medically necessary. If they have some pain that pops up, Tony's talked about it before, pain, 5 out of 10 back pain does not necessarily mean that it's medically necessary. Full stop. Right. So, I don't understand really the point of this. Like, just you could do a phone screen with a Medicare beneficiary and be like, ask them questions about how they're moving, what's going on, what's your situation, what is your current status now? Oh, you don't need a cane or a walker. Oh, you're able to dress and bathe, cook, clean, personal hygiene, all that. You're able to play What did you say? Oh, you played 15 minutes of pickleball? Okay, that's definitely not medically necessary. Oh, you're playing pickleball through knee pain? Okay, well, most practices across the country will bill Medicare Part B for that patient, and that I think is fraud. We'll have to check the legal department of our podcast, but I think that would be fraud. I think that would be inappropriate, and so these folks should be paying out of pocket anyway for that exact situation, like those examples. They should be not utilizing Medicare beneficiaries' services and all those dollars. So I don't understand. Like, there's so many therapists that just want to, milk the system. They want to bill the insurance or Medicare, whatever's available, and rely on that and not own a dollar amount. Like, not own like, hey, we charge 100, we charge 150, we charge 250 per visit, whatever. They're afraid of rejection. They're afraid of people saying no. They're afraid that there's not enough people nearby to actually say yes to those self-pay services. There's so many things around this that it's like, I don't even know if this makes sense. Like, you opt out, and now you better buck up and get ready to, pitch these folks a self-pay rate and not have, and tell them why you can't bill their Medicare services for that evaluation or that treatment.
That's the thing. I think that it's easy to hide behind the idea that I'm going to be mad and frustrated. You're not paying, Medicare doesn't pay me enough. Yeah, but they're paying for what they're expecting, which is, glute sets and very basic minimal stuff. And then on top of that, going back to, it limits our ability as a owner. If I went to the Dodgers and I said, look, owner of the Dodgers, you cannot earn more than this it doesn't matter if you win games, lose games, or whatever. An interesting thing about MLB, I didn't know this, the organization takes all of the money, divides it up equally across all of the teams. So the A's, who have a very low budget for what they're paying their team, get the same proportion of the absolute dollar amount that MLB makes as the Dodgers, who has a massive, huge budget for what they're paying, and so the system is just designed to squash anything innovative, beneficial. You are penalized for doing more than the bare minimum. And as a result, it just pushes everything as low as it can possibly go. But I would still go back to saying, I think we've taken advantage for too long. At some point, it goes bankrupt. I think that's in the cards. Like, that's not a surprise. And so what are we doing right now to prepare for that? Well, we monetize with media. We monetize with merch. We turn great therapists into celebrities because they deserve to be. And we turn it into a spectacle. Let's bring back Barnum and Bailey. Let's bring back, making this exciting to see. What?
No, just because I mentioned PT Barnum last episode.
Yeah.
So my ears are ringing.
Yeah. Jimmy, you're quiet. What are you thinking? Because you're kind of, go ahead.
Let's just do like a little exercise. Let's say I want to use Tony Maritato's clinical based content for my concierge pain relief platform. Let's say I wanted to use Jimmy McKay's voice, reach, his assets or his talent. Talent is like, really, we're talking about talent here with the Barstool and all that. So if I wanted to use either of you guys and we come up with some, agreement or something, like, how would that work? I think there are physical therapists. Like, there was one Tony brought on, David. He's in Miami.
Yeah.
He was doing the online stuff. Let's say, like, I wanted to, have some contract with him, and it's and the contract could be like, everything you make is mine for the next 1 year, 3 years, whatever, or some of the things you make, we are allowed to cross post to our platform, and we kind of get your content that you're making, and we put it on our platform because we're basically using you to create organic, new content, keep the content going without me having to, pay for a videographer and editing and all that. Like, there's so many things that are possible. I think I'm certainly interested in kind of a little bit, excited about what's possible. Are those the things you guys are thinking about, or what?
Jimmy?
I don't know. I want to hear your thoughts. I don't know right now.
Yeah, for me, that's exactly what it is. So I've been collecting data from therapists who are willing to share the information. And I'm going to break it up into kind of 3 tiers. So you've got the beginner therapist. They've been a therapist a long time. They're just starting to grow social media. They have a couple hundred followers on 1 or 2 platforms. Most of those therapists, they're out there, like they want to do what Dave is describing, and they're doing deals with product companies. You get a free pair of shoes. You record an unboxing video. There's no monetary compensation. Maybe you get an affiliate link, but they're getting started. They have no audience. So those, even though they're, putting content out there, nobody's really seeing it. Then you've got a mid tier, and I would put myself in this mid tier. You start to have a following. You start to have an audience. You've built a community. You have, for me, my YouTube channel, of course, all the socials, but I also have my Facebook group. It's like 20,000 members and a couple other things like that. Now, if that same product company wants me to do something, I'm going to charge for the video, usually $300 to $500 for a 60-second short vertical format video. And then I'm going to get an affiliate link. So I just negotiated a deal with the lift chair where the Amazon commission is 3%. I said, I need at least 10%. It's a $600 chair. Yeah. So, we were selling one a day. So my video, it was, I want to say $350 because we did a deal for multiple videos, $350 a video. And I've got a 10% commission on any of the affiliate links that come through. But then at the top tier, you've got people like Bob and Brad and Ask Dr. Joe, and you've got multiple therapists with million subscriber accounts. My bet is they're doing $10,000 to $15,000 brand deals. They're doing much higher numbers. Plus, they have the monetization from the ad revenue that shows. But my thing is, so if I'm going to go out there today and I'm going to see 12 patients, those are 12 engagements. Those should be minimum 12 pieces of content. And if I angled the camera correctly, like I bought, and this is genuine, a really great lightweight walker, 11 pound walker, because my patients couldn't lift the 20-pound rollator into their car. So I spent the money. It wasn't given to me, but I recorded 5 or 6 little mini videos of different people doing different things with this walker. And now I reached out to the company. I said, hey, I've got this. This is what's going on. This is what I want to do. I want a 20% affiliate commission. And I will promote, all of your links and all of my content that uses this walker. And so that's where, again, the numbers that you guys see that I share, it's all profit. Like, this doesn't cost me anything except a little bit of time. I invest about 10 hours a week on average on the media side of things. But it's usually 10 hours that I'm not doing patient care. I still have my normal patient care.
Traditionally, I think this is an absurd idea because healthcare has always been behind a curtain, right?
Yeah.
But PT's always been in an open space. And yet tradition ensues, right? Like, tradition says, like, no, you can't possibly do this. But that guy with the big green hammer, the chiropractor with the big green hammer, like him making videos, like nobody bats an eye. I mean, they bat an eye the fact that this guy's like adjusting people with a giant green plastic hammer and he's, hammering on people. This is an attention economy. Seth Godin is a great writer and a great thinker. He writes a blog every day for the last, 15 years or something. Today, his blog was about the 3 types of ad models, which essentially are traditional, which is I need to create enough this is CBS, this is Netflix. I need to create enough content to get you to pay attention so I can sell an ad to Kellogg's or Ford. And the problem with that ad model is now I'm focused on 2 things. Am I a content creator, or am I creating it for an audience, or am I creating it for Ford? So you're only as good. Now you're juggling 2 different things. The second type of ad model is more of a classified ad. Classified ads used to pay for the entire newspaper. This is a thing that both sides were valuable, right? Like, I want to ignore commercials because I know Kellogg's wants to sell me cornflakes. So I'm going to zone out. I'm going to run to the bathroom real quick and then come back. right? But a classified ad, I need a job or I'm looking for a pickup truck and you're trying to sell a pickup truck. It's that intersection, that connection. The third model is permission marketing. You asked for it, therefore it makes it valuable. Like if I had a favorite food truck in Brooklyn and I like signed up for text alerts, so when I got that ad, I was super excited. If you can get into the third one, because the second one's already gone. Google ruined classified ads. It's over, right? It's gone. If you can get into the third one, which is permission marketing, that's where you've got it. So what Tony is suggesting is that create content that satiates me for 12 seconds or 38 seconds or 45 seconds that I find soothing. Like ASMR is a great example. It doesn't make any sense except people watch it because they like how they feel while they're consuming the content, right? If you can figure out how to slip an ad in there or to monetize that, you're a very rich person, right? The platform will reward you for time on that. What I'm getting at is if someone makes a video like people clipping toenails, there's an entire subgenre of toenail care.
Good Lord.
It's weird. So I guess you could monetize it with toenail clippers, but it doesn't go beyond that. Instagram will reward you with nickels and dimes for keeping people on the platform longer, but that's not a long enough strategy for you. So you have to figure out what business you're in. Like I've said this before, I've said this 100 times when I've worked with professional associations, when I worked with individuals. What business are we in here? What's at the end of the rainbow? I mean, I hosted a podcast for next month. It'll be 10 years. I understood. Wow. I thought I did anyway. Understood my audience. I was an internal to the profession podcast. Still am, right? So when an organization like a large PT organization wanted to come to my audience, which they knew were PTs, I could say that within a shadow of a doubt. No one outside of professions listening to this podcast. I'm okay with it. But then I could turn to them and say, you need to hire people? I've got them all in one barrel. So I would typically price it with the answer was one. What do you net on one hire? What do we get on one hire if we do this ad campaign for a year, right? Because we're in it together, except it's so hard to track sometimes where that comes from. So I would say my response, this is where I sort of disagree with Tony, was I always said, I'm definitely doing work and putting you there, so I'm definitely getting paid. If this goes through, like that's what you do. When you're Lexus and you put ads in right field in Yankee Stadium or on CBS, you're saying, this is going to work. This is going to work 10x. So I'll pay you. So my model was always, I'm definitely doing work and showing up twice a week, every week for 10 years. And you value that. Otherwise, we were not on the phone together. We're not emailing about this. I'm definitely getting paid. I would always price it based on the outcome. I like pricing things based on the outcome.
I think for Dave, what would be interesting is like if we take this to value-based care and we talk about, what Dana's been talking about and all of
right.
This
gets interesting.
The real value of someone like Dave and what Dave has created, Dave's people, his team that are willing to go out to patients' homes, is that he would bring that media to the team. So if I'm sitting here as a specialty surgeon and I want to deliver a value-based care experience to a patient, I see somebody like Dave. He's got the look. He's got the channels. He's got he can speak on camera. Like, I don't even care about the therapy. The therapy is expected. The outcomes are expected. I want his access to the community of wealthy individuals who are going to buy the surgery that I want to deliver. And again, that's Ohtani is everybody's going to tune in. We just bought a month of Apple TV because we wanted to see one of the Reds games that wasn't on the local network. So we had to do Apple TV to watch. And I think it was when they were playing the Dodgers, so bringing Dave into a value-based care model isn't about the quality of the therapy. It's about the media and the attention that he and his team can bring to it.
Yes, agreed. And here's a great line that I've said before, which is content is king. Everybody heard that one, right? Content's king, but distribution is the Pope. That's above it. So you got great content, but no one sees it. Awesome. Cool story, bro. Tell it again, as the kids would say. Content is king. Distribution is the Pope. This is where consistency takes over. I mean, in the last 10 years, many large organizations, some of which I helped, tried to start podcasts and didn't go anywhere. Do you want to know why? I helped them. They had me. Why didn't it work? They weren't consistent. I told them what to do, and they did 46% of it and got 12% of the result. The magic is in when you get above 85%, right? It's consistency. So content is king, but distribution is the pope. Great video, but no one saw it. Doesn't matter, right? Does not matter.
You had a video queued. Go ahead.
Real quick, you see this live comment from on LinkedIn from Leslie Walkie. Could Jimmy McKay be any more brilliant?
Yes.
Wow. High praise.
I could be way more brilliant, Leslie. All right, let's talk about Leslie for a second. Do you guys know Leslie?
No.
Just she oncology physical therapist, like wrote the book, right? Decided she was going to create a YouTube channel. This is years ago. Leslie, if you're still there, like comment like the deets, like give me your back of the baseball card. Decided to create a YouTube channel and a Facebook group called The Recovery Room. This is a great model, in my opinion, and I've been in Leslie's corner and waiting for her to explode, and she's exploded, right? I'm waiting for her to be an Dr. Joe or a Bob and Brad soon. Here's why. Unfortunately, lots of people get diagnosed with cancer every year, and unfortunately, they have no idea what to do next. That's where Leslie lives. She lives in that next. What do I do? Do I move? Do I stop moving? Do I exercise? Do I not exercise? She's been doing it for years, so she has super specific information, which 15, 20 years ago would be like, well, that's limited. Except now she can reach them. Now she has a way to reach them. So her content was king, was great to have, information great to have about what do you do with a cancer diagnosis. But now she's able to actually reach and target those people over and over. And unfortunately for everybody, but fortunately for Leslie, there are people entering her ideal viewer or her ideal, client every single damn day. And they need her. It's not a want, it's a need.
She's got 25,000 followers on her Facebook group.
She's not messing around. Page. Yeah, she's not messing around. She was making videos 15 years ago when it didn't make any sense. But it made perfect sense. That's what I'm saying, Leslie. It didn't make any sense why you're just, in a white coat in front of a green screen. I mean, she was doing it before anybody was doing it.
Jimmy, you had a video or something queued up?
Oh, yeah. It's so funny. We're talking about this will be the last thing. We'll go to the video. 3 types of marketing. Traditional. I make, an episode of The Fall Guy. It was a TV show in the 80s. Look it up. I make an episode of The Fall Guy. You watch long enough. And then I show you an ad for Ford or Kellogg's. Classified ad, you put an ad, I run to it. We both, I just got a text message from my local supermarket. You're running out of time. August offers expire. They got my attention enough because I need food. Here's that video. So Tony, wait a minute. Here's a person doing what you just said, which is they're in clinic. They're seeing 12 patients a day, whatever. This is an injection doc. I'm trying to look precision care medical sports performance. They're talking about chicken guts, chicken beaks, right? Visco supplementation, knee injections. But why don't you like this video?
I'm sorry. I love that these guys are doing it. I love everything they're doing it. I just find it interesting that they chose this particular. So my mom was from Colombia, South America. My kids call her abuelita. Like this is an abuelita sitting there on the plinth or on the treatment table. I think I'm going to say physician administering the injection, he kind of got a little defensive. He kind of came across a little bit abrasive. I mean, all of these videos, it's like clearly painful. This is clearly not a pleasurable experience. I just find it interesting that they chose to capture something that is kind of negative. And they don't even show like, oh yeah, I feel amazing.
Right. There's no payoff.
Yeah. Like I want to see her jump around and stuff.
Also, I'm a radio guy, right? So like camera angles really aren't my thing, but can we stop with the upskirt abuelita angle? Why are we?
That's bad. That's really, really, really bad. Like, were they sitting on a stool? Whoever was supporting it?
That is.
Yeah.
It's a weird angle. But yeah. So this could have been very, very different. If you're watching the video and you're listening to the podcast, this essentially is a woman who's getting knee injections, both knees. You can tell she's apprehensive. And while the injection's happening, there's some discomfort there. You're going to feel a little pressure. So this is one of those situations where the 32 immutable laws of marketing is make the visible invisible or make the invisible visible. This is a way for you to pull back the curtain.
Yeah,
right?
we want to keep the curtain covering this.
The way they could have twisted this is like show a little bit of uncomfortableness, a little bit better without the upskirt angle, and show the payoff. Why would I do this? Like, there's a bunch of pain. Okay, great. I'm gonna avoid that. Like, I'm out, bro.
And then the patient is trying to say where she has the pain. And I see this all the time. Like, I talk to the surgeons, or they're like, well, it's going to go through the whole joint. The patient is trying to say my pain's on the inside. And he kind of reacts and says, I know what I'm doing, but he's going in from the outside. So part of it is, even if there's going to be a placebo benefit, you just wipe that off the table, because she thinks you're giving me the injection in the wrong spot. But then just kind of the smugness on his side. I recorded something the other day, and I'm like, this did not capture what I want to share. So I didn't share it.
Don't share it. Do you go in with an idea, or 85% of an idea to a video, Tony or Dave, now that you're doing this? Do you sort of understand, what percentage do you already know is already going to happen, and what percentage is what proactive, reactive?
Let me answer real quick, and then I want to hear what Dave says. So yesterday, I knew in my head, okay, I want this patient to do squats. I want her to do squats on this adjustable chair. I set up my tripod. I put it down while I'm talking to the patient and getting everything ready. Like, I knew right then and there. I didn't pre-plan it, but I knew when I said we're gonna do squats. I grabbed the tripod, the phone, set it up, and then it was very seamless. Same thing happened with a patient who we used the TENS unit to reduce a little acute pain. I knew I was gonna grab that TENS unit when the patient walked in the door, because I just saw the way he was moving. And so I went and got the TENS unit, the phone, and the tripod all together, set the tripod down, hit the camera on him, and then we didn't even discuss it. I've done multiple videos with this patient, but I knew right there, this is going to be great, because this is the situation that hundreds of thousands of people at home are dealing with right now. The leg is swollen, the leg is painful, it's hard to move, they don't know what to do. And so I'm going to capture in real time me explaining, it doesn't matter where you put the pads. This is how you're going to set the intensity. This is what you're looking to feel. Don't make the muscles twitch, but do this and do that. And it's been great. And I put it yesterday on my, I think, Facebook and all the socials, and it's generated a couple thousand views between yesterday and today. There's been a couple clicks, because I also shared the affiliate link for the TENS unit. And so there's been a couple clicks through the video to the link on Amazon that I could see. And I think we sold one or two of these specific TENS units yesterday after posting that video.
I mean, obviously, I'm pretty new at it compared to Tony, who's been doing it for years and has, what'd you say, Tony, thousands or maybe tens of thousands of video clips?
Thousands, yeah.
Yeah. I mean, I think most of the time already, as I'm doing it, I think I can kind of foresee the response or this or that. The one thing I don't think I accounted for, maybe need to pick like certain clients better or whatever, but like some people are like totally natural and comfortable, like before the phone comes out or before recording, and then like the phone comes out, and now it's like, whether it was my therapist or the patient, now everyone's like they're like kind of like deer in headlights, and I'm like, oh man, this does not look good at all. Like I can already tell. Like, so now, but in that visitor session, then I have to do 2 or 3 video clips or my phone up or whatever, ask them questions, kind of do a talk over or whatever. And then it seems like the therapist and or the client kind of relaxes a little bit. So maybe that's natural. Maybe, I need just more reps, but folks, therapists and patients and clients are not used to it, right? They're not used to a video camera or a phone or whatever, recording some of their, personal healthcare issues, pain, whatever, treatment, whatever it might be. So, maybe that's just natural, and I need to, get some more tips from Tony.
Everything we do has secondary downstream benefits or negative aspects that we don't think of. I can tell you honestly, because I've been doing it for so many years. I've got so many videos of patients 10 years ago, and I can literally bring them back and be like, I've got a patient right now. She was coming in 2017. She started. was coming with her husband. Now imagine this. I've got clips of her doing things in 2017. We're in 2025. So 7 years or 8 years later, lots have changed. Her husband passed away during that time. She had a situation, and I can share this because she gave me permission, and she was living at home alone. She fell. She was stuck on the floor for 2 days, 48 hours, until she realized she had a push button that she could push to get assistance to come. That ended up, she was in ICU and then skilled nursing, and then went through this whole, medical cascade. Now she's back in the clinic. I shared a video of her yesterday, and I went back with her, and I was like, look, this was you in 2017. This is you today. You're doing amazing. Like, you are doing so incredible. I had another guy who I had video of in 2019, before bilateral total hip replacements. I could show video comparison of him then and him now, night and day. You wouldn't even think it's the same person. So a secondary benefit is I can go back, because I have patients for so many years that just have always been coming back. And I go, look at where you were. Look at what you were doing then. Look at what you were doing now. It could be beneficial. It could be motivational. I just think it's an incredible thing. And when I go back through my YouTube channel, people love seeing those clips of them back then.
Do you have any plans on doing split screens and posting a video of that woman? Like, here's the video clip of her from 2017 and then now for 2025. It could just be her walking or doing a movement or whatever. Sure. Like, any plans on doing like a split video and posting those?
Yeah, I've done it. I've got a couple of them out there. It's really cool. I don't know that it has the impact that I would like it to have, but I've done it pre and post. And, I think a cool one would be a third perspective of a patient watching a video of themselves when, back 7 years ago, and how they react to watching themselves 7 years ago. And then them trying to do what they were doing then now. There's a way to do it better than what I've done. But yeah, 100%. That should be
regardless of the online social media benefits. I'm thinking of the patient, either the two examples that you just gave. They're watching a video of themselves from, what'd you say? The one was
2017
8 years ago?
Yeah.
Multiple years ago. If I'm your patient, Tony, and you're showing me a video from 5, 7, whatever, 8 years ago of me, and then you just evaluated me, you're treating me, and you gave me just even the verbal confirmation of like, hey, like, this is how you were doing then, and you're doing like, you're looking the same now. You're doing great. I'll take video of you now, or I just did take video of you now. Look at the side by side. Look at this difference. In terms of a in-person business benefit, I mean, I'm never going to leave you. I'm never going to go to another physical therapy office. I'm not going to, opt for some other treatment or care or whatever. And if I did get, some consult for some other surgery or injury or whatever, I'm probably going to come back to you and ask like, hey, what do you think? Whatever. My point of this is this I think could help any practice in the in-person plan of care buy-in, the whole therapeutic alliance. I mean, that type of patient, they're obviously coming back. So they already have not left you, but I feel like that would just be another confirmation point. Like that, I feel like could result in word of mouth referrals and benefits. And like that person could be a raving fan if they're not already, and assuming they probably are already, but if they're not, that experience, even if you didn't record it, I feel like could be a word of mouth explosion for many practices out there.
Yeah, I mean, I would ask both of you guys, maybe Dave in a little while after you've been doing this a little bit longer, which is, could you have no views but still have benefit from recording videos?
Yes.
And the answer
yeah, absolutely.
Right. Because now you're making me feel like a hero, right? This is why when you ride Space Mountain, they ask you if you want a photo. This is why when cell phones and smartphones started having cameras, if you were in the photo booth industry, you would have said, it's over. Might as well pack it in. And yet I was at a bowling alley the other day, an arcade, and it was a Marvel photo booth that had like some sort of like filter that you could be standing there with the Hulk or look like the Hulk, whatever it was. And it was a $9 photo. And I don't know if it made money. I don't have the stats on that, but it exists. There's no way Marvel is dropping whatever it costs to develop that, market it. They obviously white labeled someone else's thing, but like they understood what game they were in. It was not just produce an image anymore. Like be more like that Marvel photo booth, be less like Kodak, who had the world by the short and curlies because they had the first digital camera and they punted it because they didn't want to screw up their main chick with their side chick, but then the side chick was actually a longer term play. Understand what business that you're in. People are going to be resistant, which leads me to our final topic for the day. Tony, we've talked about this before, which is these machines. We're looking at, can you guys see this? Why is this video not playing? Oh, but I have to be on I've got to be on the video. So this is Ali Spagnola, who is going to get a massage done by a robot. She's wearing this like essentially like Lululemon tight fit outfit, and now a robot is massaging her. What does this mean? Is this the digital camera to physical therapy's Kodak film?
So I know we've had these conversations before, but the reason why I shared that particular video with you guys is because some of the things that she said I thought were very impactful. She said, one, she is socially awkward and she doesn't like the person-to-person engagement with the licensed massage therapist. I just said the same thing to my wife. I was like, I would love to get a massage, but I don't want the weirdness 60 minutes later of getting up and the massage therapist giving me that look like of satisfaction, like they did such a great job. And I have to feed into that and be like, oh, it's amazing. I don't want any of that. That to me is uncomfortable. She encapsulated that. She said that she doesn't have to get all oily because she puts on this special suit and it prevents you. So I always think of patients that have, skin lesions or different things that, again, they wouldn't get a massage with human contact. But if you put this barrier over them, now we're opening the door to people that were not customers before. She talks about it remembering, because it's a computer, pressure and different things, and you can program what you like and what you don't like, and like all of these aspects that a human cannot do. And so it is a different experience. And I think she said that also in there. It's just different. It's not like a massage. It's a different experience, but it's got its own host of benefits that the traditional massage doesn't have. And so what I love about that video is the way she conveys all of that information. It makes you realize, oh, maybe this is something I want to try.
What percentage of the population do you guys think in the U.S. have that, either they, like that woman or Tony, or whether they admit it or not, but they have some of that social anxiety where they would be the ideal fit for this? We got 330 million folks in the U.S., approximately 350, something like that, in that range. 10%, 15% of folks where this is the ideal fit for them. I mean, I like you.
I'm a outgoing guy. I'm a pretty outgoing guy. I can get massages now, but I didn't for the first 30 plus years of my life because of that. Because I was like, am I naked? Is this weird? Do I have to whatever? Is this a dude? Yeah, for me, I'm a pretty outgoing person who doesn't really get bothered in social situations. I avoided it at all costs until it was given to me at a retreat. That was it. I don't even know if that's the biggest benefit for this. Like, to me, this is a loss leader. This is a gateway drug, right? We also have Normatec booths. We also have red light therapy. We also have this. This is like the try it in. This is like the rotisserie chicken at Costco. That's how I look. I don't think it's
going to be quite an expensive loss leader, Jimmy. I mean, how much do you think this place costs? 20 grand, Tony?
$7,500 is what someone told me.
Really? I thought they were
like 7,500? No way. No, at least 70 grand.
A lease. And
I would have thought like $80,000 to $120,000.
Yeah, I think it's $7,500 a month.
Okay. Dave, to your question. To your original question, I would bet and it seems to be going up, like the number of people who are socially awkward on some sort of spectrum, don't want physical human interaction like that. We see what's going on in Japan. We see what's going on in some other countries. I do think that number is on the rise. I don't have the number. I'd be curious just how many people are diagnosed with like Asperger or any of the spectrum disorders like that. Definitely going up. Definitely going to be up there.
They're really quick. There is a barrier with this that we talked about personal trainers a while ago using those bodysuits that have the EMS, like the almost like stimulation in the bodysuits. You remember we talked about that briefly or no?
Yeah.
So there's like these full bodysuits, and I forget what it's called, an EMS personal training or whatever. But then the suit gets sweaty, and then you got to clean it or whatever for the next client. And this is a barrier for this machine or this device, is that someone has to put on a bodysuit. You guys talk about socially awkward, or like some people that have what's the comment?
I think Hathel is talking about after COVID about 30 to 40% in terms of like anxiety and feeling awkward in social situations.
The full bodysuit. There's other folks that have oh my gosh, what's the proprioceptive issues, right? So like I think some of these folks that are in the bucket of maybe this social anxiety, whatever, wouldn't they also have a problem with this tight bodysuit that's like this, Under Armour second skin type bodysuit?
So I think where we go with it is then you go to some sort of blanket or covering, even like in wound care, if you're doing shockwave, you put a plastic bag over the head of the sound wave. There's always going to be innovation on how we do this. The machines didn't exist, so we don't know how the public, the general population is going to respond. But the same thing with like flotation tanks, and there are so many things that, it's not appropriate for everybody. I do think it's cool. I wouldn't make the investment myself, but I would go be a customer.
I'm curious, and I love, as you guys do, dipping into the comments. So Brenda, and I don't know Brenda, I would love to hear where she got this information, but she fires back, I hear they break down often, ellipses. And I'm saying, I'm just I don't know if I'm pessimistic or optimistic. I think I'm realistic. And I said, Brenda, which ones? Like, this is a relatively new technology. She already has inside information that they break down often. And I said, which ones? And she said, LOL, the people and the mechanical massage tables. And I don't know where that's going. This is me being maybe pessimistic now, thinking, I think Brenda feels threatened by this. So she points out they break down. I've seen nothing that says these things break down, but maybe I'm wrong. That's why I asked which brands. And then, of course, Brian saying we're doomed. Why? I don't know. Is this a threat response to people who might see this as a replacement? Is this Kodak responding to digital cameras?
Yeah, I don't think I shared it. I started to type it and then I deleted it. Or maybe I did share it. I don't know. I said basically it's hilarious to me that somebody, not talking about these posts, somebody would say, an AI scribe made a mistake or it hallucinates. I'm like, seriously? Have you not looked at the stats on humans?
You had people.
Like the number I saw yesterday was 88% of the documentation around prescription medication had mistakes and was inaccurate. 88%. I guarantee I make 1,000 mistakes a day, and their AI probably doesn't make half of the mistakes that I do.
Yeah, when the self-driving car runs over the first 7-year-old, or it already has, it's national news. It's not news when a random person runs over a 7-year-old when school starts again in September. It is, but they are two different stories. And I was taught this in journalism school. It's only news when it's rare, right? Like, this is why this is why the phrase, when it bleeds, it leads, happens. Like, we make a sensation out of it, and then we have to tell that story. And if it's harder to tell that story, we don't put as much energy behind it, and also it doesn't go as far. So yes, when the self-driving car runs into someone, we go, see? And then the smart people will go, in the time it took you to say CCC, 4 other humans ran over people.
So real quick, but
shots.
We're running. I didn't realize we're running late. What do you guys got for parting shots?
So Jimmy said school starts in September. My kids are already in school. They literally, today was the first day for my last kid to start school. So to all the parents out there, congratulations. Another year of school is starting. I wish your kids the best. I know I had to send my kids kicking and screaming. They hate school. And I don't blame them. I did too. That's my parting shot.
With the massage thing, cool technology. It's going to be for the part of the market that is price conscious, maybe also that have the social anxiety and all that. It's going to be low margin. I mean, there is no labor, right? So you take the labor out of the massage, but consumers across the country are not going to be willing to pay as much. There's some massage therapy places here in New York City, as you can imagine, that charge pretty premium dollars for 60 or 90 minutes. So I don't see the benefit of this device, this machine long term for the cost. Now, of course, Tony's going to say the cost is going to, go down over time with better technology and all that and better chips or whatever technology. But I just can't see that as a long-term business that consumers are willing to pay a premium price for. I think consumers will like it. They'll want it as soon as it gets over $50 or $70 per massage from a AI mechanical massage. I think it's going to get crushed in the market. And as always, there's always going to be the human-based, service-based businesses that will be available to infinity, regardless of AI and technology.
Yeah, I mean, on the topic of a massage table, whatever this becomes, this isn't it. Like, this is version 1.0. So people are already poo-pooing this. I think the people who invented it are probably saying, I'm going to put this out there as a beta test to see what is going to be good and what people like and people reject about it. There was that massager that you laid down and it put a rubber thing over you and shot water at you. Remember that? That's good. Like, well, why didn't it take off? Even if it feels just as good, there's reasons, right? Because so my parting shot would be understand what business you're in. Are you in the massage business or are you in the experience business? Because there's candles and there's oil and there's scented things. Like, it's an experience. So can the robot deliver an experience? Right now, that one, no. In the future, remember, only the Sith speaks in absolutes. Right? So this will definitely never take off. My Spidey says, interesting. Maybe not this how, but this what could take off. So my parting shot would be understand what business you're in and then figure out what the future of that business is. Because that version of that robot, that ain't it. But neither was the computer. Who's going to, Hewlett Packard, who needs a computer at their house to do their taxes? Yes, looking at it that way, you're right. No one needs a computer. 1.002% of the population needs a computer, except that's not how it ended up.
Hey, it's Dave Kittle. Are you a healthcare business owner or physical therapy practice owner who is looking to figure out your succession plan or exit strategy? We might be able to help. And in fact, we may be interested in acquiring your practice. If you're interested, you can reach out to me. Shoot me an email at dave@conciergepainrelief.com. That's DAVE at CONCIERGE painrelief.com. Or you can call me at any time, 646-781-8884.